Hello, I'm Jen Benner from the National Sexual Violence Resource Center, and I'm happy to welcome you to the webinar SARTs in Detention Part 2 Implementation. This is the second webinar in the SARTs in Detention series. The first webinar can be found in the SART Toolkit. NSVRC would like to thank the Office for Victims of Crime for their support, funding of this webinar and the entire SART Toolkit. We also would like to offer the disclaimer that the opinions, findings, conclusions, or recommendations expressed are those of the contributors and do not necessarily represent that official position or policies of the U.S. Department of Justice. Today's webinar is one of many webinars you can find in the SART Toolkit at nsvrc.org/SART Toolkit and in the SART webinar series. I'm so glad that Jessica from Detention International could join us today, and so I would like to now turn it over to Jessica for her introduction and her presentation.
Hi, thank you so much. So yes, my name is Jessica Serrano Seipel. I'm a program director with Detention International. JDI, known for short, is a health and human rights organization that seeks to end sexual violence in all forms of detention. It's our fundamental belief that no matter what crime a person may have committed, that rape is not part of that penalty. It's our mission to hold government officials accountable, to change public attitudes about sexual violence behind bars, and to ensure that survivors get the help that they need. And as was mentioned earlier, there was a part 1 to this series that went into a lot more detail about the Prison Rape Elimination Act, but it is sort of the foundation of a lot of the work that we do, so I'd like to go over it very, very briefly. As you can see here, the purpose of PREA is really threefold. It's to eliminate sexual abuse in all forms of detention, to increase accountability through a comprehensive audit process, and to increase awareness through that process. And to ensure that survivors receive a similar standard of care regardless of where they live. And that's something that I'll return to throughout this webinar. It's also important just to note that there are 52 prison and jail PREA standards, and these standards are sort of requirements that facilities must undertake. Juvenile facilities also have a separate set of PREA standards that are unique to those facilities. So most often when rape crisis centers or community organizations are developing a relationship with their local facility, the MOU process is typically that first step. Developing MOUs with your local detention facilities is an important step in ensuring that incarcerated survivors have that access to advocacy services. PREA also requires that facilities maintain or attempt to enter an MOU with community-based rape crisis centers. Developing an MOU allows for facilities to understand the crucial role advocates have and allows for advocates to understand the culture and needs of that particular facility. Advocates and corrections staff have a lot to learn from each other, and the MOU negotiation process is an opportunity to demystify what advocates can offer. It's also a place to address any safety concerns on the part of advocates and the part of corrections staff as well. It's important to ask questions about security policies and protocols during this process so that advocates providing in-person services are familiar with the environment they'll be in. The MOU process is also a place to affirm the importance of confidentiality and to discuss ways to ensure survivors are able to access emotional support services in as confidential a manner as possible, as described in the PREA standards. During this stage, be prepared to discuss why confidentiality is important for survivors, along with how protecting that confidentiality can lead to overall safety, facility safety. For example, we know that when survivors have confidential access to advocacy services, they may be more likely to report abuse and participate in an investigation. Additionally, confidential support can help survivors cope with their trauma responses in healthy ways. But it's important to understand that the MOU is only the first step. Once an MOU is signed, it's important to continue to build that relationship so that the MOU is more than just a piece of paper, but instead is a foundation to build upon. One of the first sort of good opportunities there is cross-training. As I mentioned earlier, advocates and staff have a lot to learn from each other. Advocates have the expertise to offer training to facility staff on the dynamics of sexual abuse, the impacts of abuse on survivors, and how to interact with survivors to avoid re-traumatization. Facility staff can also offer advocates training on facility procedures and safety protocols, detention culture, and what resources are available for survivors within the facility. In this relationship building phase, advocates can emphasize the benefits of their services to both the inmate population and to facility staff as well. Ensuring survivors have meaningful access to the support of advocates can help decrease anxiety and trauma responses. It can also help relieve some of the burden on facility mental health staff if advocates are able to do crisis intervention. Survivors feeling heard and believed is a crucial part of that healing process, and advocates can fill that need in a way that detention staff, mostly are not able to. In the community, rape crisis centers often offer a comprehensive range of services beyond just responding to an acute incident of sexual assault. In detention settings, advocates can similarly integrate into various parts of the facility community. PREA requires incoming inmates receive education on sexual abuse and their rights to be free from abuse. This is a natural opportunity to include advocates as a part of that intake education process. In addition, advocates can offer a range of groups to inmates, from prevention-focused educational groups to even survivor support groups. Being a consistent part of life at the facility sends the message to inmates and to staff that advocates are committed to that community. Another thing that PREA requires is for detention facilities to have a planned, coordinated response to sexual abuse that occurs within a facility. This coordinated response may and should include staff first responders, medical and mental health practitioners, investigators, and facility leadership so that a survivor receives appropriate care post-assault. If this model sounds familiar, it's because it mirrors the community SART model, and it's particularly useful in detention settings where survivors face multiple barriers to reporting sexual assault and to getting help. We know that effective multidisciplinary teams result in better care for survivors and stronger investigative outcomes. A coordinated approach recognizes the needs of survivors and the specialized approach required for handling sexual assault investigations. When survivors, who are the key witnesses in a sexual assault case, are supported and their medical, emotional, and safety needs are addressed, they are better able to participate in the criminal justice process and ultimately to heal. We know what the benefits of the coordinated response approach are, and bringing the SART into the detention setting and including advocates in rape crisis centers into that model falls well within the spirit of PREA, which again is to offer incarcerated survivors the same level of care as survivors in the community. This model also ensures that detention staff responding to reports are better trained in report procedures, evidence collection, and survivor safety. Within detention facilities, various departments that may become involved in a sexual abuse report, such as investigators, medical and mental health, etc., tend to be very siloed and operate independently from one another. A coordinated response leads to better communication across these departments, which leads to better investigations. And most crucially, a coordinated response creates a facility culture that takes abuse seriously, making facilities safer for staff and inmates alike. So not only is this coordinated response a part of PREA compliance, but it also has all of these benefits, and many of these benefits are necessary for including advocates within that process. Another way to call this might be a PREA team, as the acronym SART means something very different to facility staff than it does to folks in the community. And so there are a couple ways to connect your local detention facility into that SART model. One option is to hold monthly, quarterly, or as-needed meetings that ensure the detention facility receive the benefits of that model. Depending on the type of facility in your area, investigations of abuse may be done by detention staff or by outside law enforcement. Including of investigators as a part of that team is crucial, as it will likely be investigators who are reaching out to advocates to ensure accompaniment at forensic exams and investigative interviews as required by PREA. Medical and mental health staff are also an important part of this conversation. Because survivors may be more likely to make their initial reports to medical or mental health staff, it is essential that those staff are trained in responding to reports in a trauma-informed way. Forensic exams for incarcerated survivors are often done outside of the facility at a local hospital, although sometimes they are done within facilities as well. If it's the case that survivors are being transported to a hospital or a clinic, it's important to also include those transportation officers in this coordinated response team. These officers are responsible for transporting the survivor safely from the facility to the hospital and back, while also ensuring safe evidence collection. As this can be a very difficult process for survivors, as you can imagine, it could be an hour to the hospital, maybe even longer. Having transportation officers trained in how to respond compassionately to survivors can also help to ease anxiety for everyone. Finally, having leadership included ensures that the facility takes the PREA team seriously. Detention facilities have a strong hierarchy. Without buy-in and direction from the top, facility staff may not understand the importance of having that PREA team. Developing a written response procedure that can be given to first responders is also key. It could be a little card, a little laminated sheet that ensures no matter what level of training a staff may have, anyone who receives a report is aware of who to notify and what to do. Including advocates as a necessary step in that notification process also ensures that survivors receive the support they are entitled to in the PREA standards. Beyond this, having dedicated PREA teams develop in-house expertise across facility departments, therefore limiting the anxiety that may arise if a report is made and staff just don't know what their responsibilities may be. Having these subject matter experts limits the possibility of mistakes or mishandling reports. Another way for detention facilities to be connected to the SART model is to invite key staff to join your community SART. Key staff could include facility leadership or investigations. Having detention staff build connections with other law enforcement professionals in their community can have many benefits. If facility staff are connected with local prosecutors, for example, it can help with investigations and prosecutions, particularly if investigators have had challenges in their cases being taken up by district attorneys. Because detention facilities are often so isolated from their surrounding communities, it's easy for the staff there to feel very disconnected. Inviting detention staff to participate in your local SART validates that they are important members of your community who deserve a space in the overall community's efforts to stop sexual violence. It also reinforces to detention staff that their local rape crisis center is a professional organization with established ties to the community that it serves. Just to kind of wrap things up, I want to thank everyone for listening to this webinar, for their dedication to ensuring that incarcerated survivors are not forgotten in the overall movement to end sexual abuse. Frank, who is one of our Survivor Council members, in this quote here, he highlights just how important advocates can be to incarcerated survivors. And if advocates were not involved in the process, as you can see here, he really had nobody to talk to. And so by working with your local detention facilities, you can help to ensure that someone like Frank in the future has someone to talk to about what's happening to him. There's a list of references here from the National PREA Resource Center. I highly, highly recommend this website. In fact, I cannot recommend it enough. It lists all of the PREA standards. There's also all kinds of resources kind of dissecting those PREA standards and what they mean. There's a really helpful FAQ section where folks can submit questions, and then staff from the PREA Resource Center will answer them. And so if you're having questions about PREA, or maybe the facility's having questions about PREA, you can kind of make yourself an expert by going into this website. Like I said, I can't recommend it enough. If you have any other needs or any other questions or want to connect with us, please feel free to do so. You can see here we have a website dedicated to advocate resources. On that page, there's all kinds of resources for survivors, for advocates. There's recordings of past webinars and trainings that we've done. You can also direct any questions to the email here, advocate@justdetention.org, and someone will respond to your question. Our website is here. You can also follow us on Twitter, like us on Facebook, all of that. And I will pass things back over to the NSVRC, and thank you so much for inviting us.
Great, thank you, Jessica. We hope that you learned a lot from this webinar, and you can connect with NSVRC on any of our social networking sites or at nsvrc.org. And again, you can find specific SART and PREA resources on the SART in the SART Toolkit at nsvrc.org/SART Toolkit. And again, a big thank you to our presenter and to OVC for making this presentation and the entire SART Toolkit possible, and to you for all the work that you do to support survivors and hold offenders accountable.